Good afternoon, everybody. I'm Dr. Nick Coatsworth with today's COVID-19 update. I can confirm today that there have been 7,265 cases of COVID-19 diagnosed in Australia and 5 newly confirmed cases overnight. 3 of those cases were diagnosed in New South Wales, 2 of whom were returned travellers, and 1 case is currently under investigation. There have been 2 new cases diagnosed in Victoria. 1 is a returned traveller in hotel quarantine, and the other was actually a resident of an aged care facility in northeastern Victoria. That person is currently being isolated in hospital where they were transferred for an unrelated condition. The remaining residents of that particular facility have been placed in quarantine and contact tracing has begun. There have been no new deaths from COVID-19 overnight. Regrettably, 102 Australians have lost their lives to COVID-19. There are currently fewer than 460 active cases of COVID-19 in Australia. 19 individuals are hospitalised, 3 patients are in ICU, and 2 of those are on ventilators assisting them breathe with severe coronavirus disease. I did want to highlight that the total number of confirmed COVID-19 cases over the past week has been 61. Which is down from 91 the week prior, and nearly 7 out of 10 of those cases have been overseas acquired. So low numbers of cases over the past week, sometimes in the single digits, as in today with 5 new cases overnight, and a large majority of those remain overseas acquired rather than community acquired in Australia. After our peak of cases in March, we continue to see a sustained low number of cases on a daily basis in Australia. I did want to mention today the funding announcement from the Minister of Health, Minister Hunt, of $2 million to help find a cure for motor neurone disease. I was a junior doctor at Royal North Shore Hospital when I was taught in a neurology term by Professor Dominic Rowe, who is one of Australia's leading researchers and clinicians treating motor neurone disease. Dominic impressed upon me how severe, how unrelenting the condition of motor neurone disease is, how it takes the lives of those who are affected by it far too early, takes them away from their friends and family prematurely. It highlights to me the importance of ongoing funding for research for conditions other than COVID-19, conditions that are very severe and severely affect those who suffer from them. It also makes me reflect really on the reason why we had to have the restrictions for COVID-19, why society had to undergo such a profound restriction on what we're used to, but more importantly, why we need to continue those behaviours that have put us in such an important condition, led us to such an important position. And that is because COVID-19 would severely affect someone with motor neurone disease or many chronic conditions. For motor neurone disease in particular, a condition that will take someone's life far too early, getting infected with COVID-19 would take them away from their friends and family even sooner. It reminds me that COVID-19, we are still in the pandemic, it is still a danger to us, and it is still a danger to our most vulnerable people. And the important measures of keeping our distance where we can, of washing our hands, of excellent cough etiquette, and all those great behaviours that we've learnt, they must continue. COVID-19, as we lift the restrictions, must stay in the forefront of our minds so we can protect the most vulnerable members of the community. I'm happy to take questions.
Dr. Coatsworth, should federal politicians who attended Black Lives Matter protests on the weekend be still coming to Parliament this week?
Well, I think your question refers to whether people who attended the protests on the weekend should self-isolate as a result of it. The position of the AHPPC, the medical expert panel, was very clear that we view any sort of mass gathering, whether it's a protest or large gatherings of people, is a substantial risk still, even with the low numbers of COVID-19 that we're seeing in the community. So we absolutely need to take care for those who were at the protests. Our message is clear, and that is, if you become unwell, like we say to all members of the Australian community with respiratory symptoms, then get yourself tested, because that is going to be the most important thing going forward, that anyone with symptoms who attended those protests get tested, so our public health officials can be aware of an issue if it happens.
Specifically on the issue of politicians coming back to Parliament this week, I understand you've just given a general comment about anyone who attended these protests, but these people are elected officials and they're coming here to represent, but that also means that there's people coming from right across the country who are then going to fly home to potentially vulnerable populations where they live. Are there any specific concerns about spreading coronavirus from these protests into Parliament and then across the country?
I think we've got to remember that we don't actually know what's going to happen as a result of these protests. The principle of mass gatherings being a risk is clear, and I've just stated it. I don't need to restate it. In terms of what the effect of that mass gathering is going to be, we have to accept that they have happened, and we have to wait and see what will happen as a result of the mass gatherings. There is no current recommendation that people who attended those mass gatherings should do anything different, and in fact do exactly the same thing, which is get tested if they become unwell.
If cases start to emerge out of these protests, could Australia be forced to, could states be forced to reintroduce some of those tougher restrictions that we had earlier in the COVID response?
Well, I think that depends entirely on how many cases emerged. I mean, it's very clear that we have excellent public health capability to respond to outbreaks. We have excellent capacity within our public health system. We have excellent capacity within our hospital system to treat people with COVID-19. So the system is there and able to treat eventualities like outbreaks. And like I said in response to the previous question, I just think we have to wait and see what happens over the coming weeks.
Did the AHPC, PDC have discussions about the potential to be rolling back restrictions or delaying the implementation of easing restrictions as a result of these protests?
The AHPPC has discussions on the lifting of restrictions on a weekly and sometimes daily basis as we chart our way out of this COVID-19 epidemic. The discussion today related to steps 1, 2 and 3 and the pace at which different states are going through those restrictions and what might occur beyond step 3 in the months ahead. But we did not discuss a return to more stringent restrictions as a result of the protests.
Was there any discussion in regards to how the weekend's protests might impact on the states coming out of those stages 1, 2 and 3?
Well, it's the same answer as the question before. We, as public health officials, we have to wait and see exactly what the outcome on public health and on potential new cases of the protests were. So it's, I think what's become very clear to yourselves and to Australians over the past 3 months is we can't crystal ball gaze at all. The virus dictates its own path. Obviously, we hope that there are minimal outbreaks resulting from, minimal cases, I should say, resulting from the protests. But we will wait and see what happens over the next 2 to 3 weeks.
How long till we wait and see? Are we talking a 2-week time frame, a 4-week time frame? How long till you will be able to know what the effects of these protests actually were on a medical standpoint?
So it's exactly the same as lifting of restrictions. It's the same answer. The incubation of the virus is 14 days, therefore it's a minimum of 14 days. It certainly doesn't mean that in 3 to 4 weeks we'd be out of the necessarily out of the woods. It can take a little while, but that's the same as lifting restrictions. You've got to wait a minimum of 14 days.
If 30,000 people gather in a city centre very close together and there ends up being no outbreak, won't it just cause businesses to either disregard or very seriously question why the restrictions are still in place in the way that they are and whether they should be accelerated?
I think the first thing to say in response to that question is that businesses have been very patient with the restrictions. They've obviously had a significant economic effect. Businesses have come along with the government in taking a very COVID-safe approach. Whether whether that has an effect, we heard one question, would the protest cause us to increase our restrictions? You've asked, would the protest cause us to lift our restrictions more quickly? Again, I think only time will tell, and that's the best we can answer that at the moment.
Do you anticipate that moves in New Zealand to end restrictions and things like the protest will add to people's anticipation or frustration with the lockdown? Is it possible that community sentiment might get ahead of the change in the rules?
Well, I think there's a couple of things to say in response to that. The first thing is, whilst we have put ourselves in an excellent position to lift restrictions, we're still only about 4 weeks or just over 4 weeks after the first restrictions were even lifted. The amazing thing about COVID-19, of course, is there's so much going on that it seems like a week is a month is a year, and so it can lead to the impression that things are going slowly when in fact they're going really quite quickly. And some states, through their very low number of cases, have been able to move towards step 3 very quickly. So I think what Australians are seeing, the restrictions lifting, they're seeing new opportunities available to them to go to, say, pubs and clubs in New South Wales, albeit sitting down and having a drink, and even larger gatherings in the Northern Territory and Western Australia. So I think that people are looking forward to doing those things. They're enjoying the lifting of restrictions, but I don't sense that there's any frustration. I also think that Australians realise that the situation in Australia versus New Zealand is very, very different.
And can you say anything about the discussions today about the coming out of restrictions that you mentioned earlier? Any decisions made, anything to announce from today's meeting?
Well, as you know, everything that we discuss in terms of very clear pathways needs to go to National Cabinet first. But what I can say today was a general discussion. As I said, we've only been lifting these restrictions for 4 weeks. There are many months to go in this COVID-19 epidemic. So today was a general discussion on what life after step 3 might look like.
AMA President Tony Bartoni this morning said that anyone who attended the protest should be self-isolating, and also mentioned, the potential of mass testing these protesters. What would be your response to that, and who should people be listening to when there are so many voices currently speaking about Australians' health?
Well, I'll address the last point, which is that Australians should be listening to their state chief health officers and the health expert panel to which they all sit on, the Australian Health Protection Principal Committee. That said, I'm aware of the AMA President's comments. They were obviously born out of a highly precautionary approach. It is not something that the AHPPC has specifically discussed, any requirement to self-isolate after a protest. Obviously, there would be some challenges in implementing such a policy, and I would simply say to protesters who might be concerned that they simply follow what their state and territory health departments recommend. But I fully endorse the AMA President's suggestion that people with symptoms who attended the protests get themselves tested. That is absolutely critical.
In regards to the protests, a lot of people out there, are sort of frustrated in terms of they saw the protest on the weekend, 30,000 people there saying, why can't I go to a footy game to a stadium with 30,000 people? So what would you say to people who might be feeling that level of frustration in terms of why that, but not a game of footy or whatever the case may be?
Well, I do understand why that might frustrate people. I would point out perhaps that we don't have protests on every Friday and Saturday night of the footy season, so there are some substantive differences to it. The return to stadium sport and spectators is something that the Australian Health Protection Principal Committee is considering, is something that we have been discussing. So there may well be a way to do that in a safe, measured way in the coming months. So I guess in principle, I think there is a rather big difference between a single protest and a return to spectator sport in Australia. Returning to spectator sport in Australia is a really important thing for all Australians to see us working towards, and we're doing that. Well, now I think we've got some...
James. Yes, Dr. Constable, James O'Doherty from the Telly here. Thanks for this. I've got 2 questions, actually, so I'll roll them into one if it's all right. Would there be any less transmission transmission of the virus occurring at these protests if the people who attended these protests started self-isolating now, rather wait until someone had been identified and the contacts then traced back to them? Would there be less transmission if people self-isolate now? And secondly, will any easing of restrictions now be put on hold essentially for 2 weeks until the AHPPC finds out whether there has been transmission at these protests?
Okay, thanks, James. So the questions were if people who attended the protests self-isolate from this moment in time, would there be less transmission? And the second question related to was a similar question to the one previously asked, which was, will this cause a delay in any lifting of restrictions? So in response to the first question, I think the nature of the protests were different from state to state. The numbers of people were different from state to state. And in fact, what people were doing at the protests was different within a given protest. Some people were on the periphery making an attempt to self-isolate. Some people had hand sanitizer. Others had masks. So it's going to be very difficult to suggest a blanket policy for everyone who attended those protests across the country, or a blanket recommendation beyond saying if you get unwell, you need to get tested. In terms of whether restrictions will be delayed, it's the same answer as I said previously, which is we take several weeks to examine the effect of lifting restrictions anyway, and obviously that gives us plenty of time to see whether there were any emerging cases from the protests and adjust our position if necessary accordingly. But that'll obviously be a matter for the state and territory public health units, which will be monitoring this very closely. Done.
Hi, Dr. Coatsworth. I just wanted to ask you about the World Health Organization announcement over the weekend that they now support members of the public wearing masks. Did the AHPPC discuss this today, and has there been any change in the position?
So the question related to the World Health Organisation's shift in position on general community mask use, and the AHPPC frequently discusses mask use, whether it's in the healthcare worker setting, whether it's in more broadly community healthcare, or more broadly than that, community mask use. So it is something that we discuss very, very frequently. There is no current change in position of the AHPPC on community mask use in Australia. Now, the reason for that is that community mask use is likely to be beneficial in communities, in countries where the prevalence, the actual amount of COVID-19 is far higher than it is in Australia. And that might include countries like Brazil, Russia, United States, where we know that there's a high probability of if you walk down the street in the community, you would encounter someone with COVID-19. So the value of community mask use in Australia at the moment, with very low numbers of COVID-19, less than 10 a day on average for the past week, is simply not there in the view of the AHPPC to warrant a change in our position on mask use. But as I said, that is something that we will constantly review and have been constantly reviewing since the start of the pandemic. I'll take 2 more questions.
Is there any more details about this New South Wales case that's under investigation, for example? Is this somebody who went to a protest, or, or is it community transmission, or is it just none of that's clear yet?
That's under investigation, and it'll be a matter for the New South Wales Public Health Unit. I would have thought, given the protests were only a couple of days ago, it'd be very early to be showing any symptoms, but more details will be available in the coming days, I'm sure.
And just on the protest, it was mentioned yesterday by one of your colleagues that potentially when people are at protests and they're yelling, that increases the ability for droplets which spread viruses to go further. What kind of role does yelling, shouting, things like that at protests have on the spread of the virus?
Well, these things are very difficult to study in sort of experimental form. You can imagine the virus forms droplets, and the louder you exhale those droplets, whether you're coughing, whether you're shouting, screaming, or even singing, they can be projected in a further than would otherwise be done by talking. So that is sort of a statement of fact. That's what happens with these viruses. I think rather than protests, I know there's a lot of friends and colleagues of mine who are more worried about choirs, to be honest, and getting back to singing. And that should obviously be done with appropriate social distance and appropriate attention to density and the 1 person per 4 metre squared rule. But yes, it does project the virus further. And that was a great way to finish. Thank you very much.